Do you believe in angels? Let's see here. I went way too far. Some people believe they are real, and they're sent to us to bear messages or to guide us to a specific course of action. July 23rd, 2010, this image appeared in the Alma skyline. Many community members believe it does represent an angel that was sent to comfort us in our time of grief over a plane crash that took the lives of 4 of our community members, including my partner, Jim Hall. Bertha Tooling believed in angels. I first met Bertha in 1984. I was a first-year medical student, and one of my first classes was geriatrics. Now, geriatrics is defined as the branch of medicine that deals with the health and care of old people. One of my first assignments was to go visit one of these old persons in their home, and that was Bertha. We were assigned in pairs, so my fellow student and I, Dave, went out with some trepidation out to the Grange Acres retirement community. We knocked on Bertha's door. We knocked again. We finally heard some shuffling of feet, and Bertha slowly opened the door. Now, I wasn't sure what I was expecting, but there's most certainly an old person standing in front of me. She looked a little dazed, like maybe we had just woken her up from her nap. Her dress was tattered, it was kind of dirty, the remnants of her food on the corner of her lip and on her dress. And she looked at us, and she didn't understand, why we were there. She didn't understand why we would come. Now, I knew that we were there because she had signed up through the Meals on Wheels program that brings hot lunches to senior citizens. It's a great program. She had signed a form permitting us to come talk and visit with her. But she didn't remember that, signing a form to let any medical students come visit her, let alone first-year geriatric class, clueless, nervous, fidgety medical students who at that point wanted to say, you're right, we made a mistake, rush back to our car, report back to our professor that our old person refused our warm advances. But we didn't. We explained to her why we come, and after a few more times her saying that she didn't remember signing any form, she let us in. Her place was, as you might expect, kind of full of years of accumulated memorabilia. And there wasn't much open space, but I'm sure that helped her navigate around her treasures as she moved around her apartment. She didn't walk too good, but after a short period of time, it was easy to tell she didn't think so good either. She kept repeating herself, and then she asked us what day it was. And she couldn't remember why we came. She kept asking, why did you come? She did remember, though. I do remember this. Sorry about this. I keep it in the bun. I do remember this. She did say, I've kind of lost faith in people. I remember always helping people in need. And now, in my time of need, no one seems to come visit me and help me. She also told us about this pain that she had in her side, that she had had for years, ever since she had had the shingles. And this pain is a complication, a potential complication of having that, and it never goes away. But it also became apparent that she really had nothing to do all day except think about how much pain she was in. We asked our questions, and we left, kind of shaken by the whole experience. Now, even with my total lack of medical knowledge at that stage in my career, it was obvious that she was profoundly depressed, even bordering on psychotic. It was just an experience that both of us remember as being kind of shaken by. So what would you have done? Well, I remember thinking back, I don't remember saying I was being altruistic or that I needed to do the right thing. I felt like I had no choice. I had to go back and visit her. Like, I would totally regret it if I didn't. And so I did. I don't know how many times I visited Bertha or when there was a change about her, but it happened. She started to care more about her physical appearance, and she put her wig on. She started going to some activities at her senior community center. And then she did actually start using soup cans as weight to make her stronger. We used to go out to lunch at her favorite place, Bill Knapp's. One day I took her to Chi-Chi's. She didn't really like the Mexican food very much, but at least she was open to the new experience. I was able to get her to a doctor and get her some medicine for her chronic pain also. But most importantly, over a period of time, she came out of her stupor. Her thinking improved, and the dark, heavy cloak of depression came off of her. Now, I would often think of reasons or explanations as why I was too busy to go out to see her. I mean, I was a medical student, right? And I had to sacrifice my time to go out and see her. But interesting, always after I did, I always felt better, like I had done something important. And she helped me too. I remember one day, specifically, it was an autumn day, and the trees were beautiful. And we're driving to this appointment, and she said to me, "Look how beautiful the trees are." I had noticed. With my medical school tunnel vision, I wasn't focused on that. I wasn't focused on the fact that I could probably be doing better things with my time that day than taking her to her doctor's appointment. Interesting now, whenever I see trees or skyline now, I think of her and rise a reminder to make a stop and look around and see the trees. After about 2.5 years, we left my book work at Michigan State to go pursue my clinical training, and I moved out of town. I didn't see Bertha much after that, and she died about 2 years later. Her family asked me to be a pallbearer at her funeral. Although they may have been a little bit suspicious of my motives at first, I think they became to realize what a profound impact that my simple act of caring and listening to that voice to tell me to be responsible and respond to a need placed before me had made in Bertha's life. I have to say that it's probably the most important thing I've ever done. And I also would say that if I claim to accomplish nothing else in my life, it in itself has made my life worthwhile. Now, I did graduate from medical school, and I think I have accomplished other worthwhile things in my life. I have 3 beautiful children, and while it didn't take great skill to make them, it did take great skill and patience to raise them. I've been a doctor here in Alma since 1991, and I've had just the great benefit and privilege to take care of so many people and be part of so many wonderful and gratifying experiences. And although I don't think I cure anybody, I've facilitated many people toward healing. I vividly remember my 3rd week in practice. I was called to deliver a baby, a young mother, 16 years old, and I suspected this baby was going to be on the large side. So I called in one of my more experienced partners to have her be there just in case I needed help. I remember the head started to come out, and it came out, and it came out, and it came out, and then it pushed tight back against the mother. Now, in medical terms, we call this a shoulder dystocia. All I could think of that time was, this baby's stuck. So thank God my partner was there, right? So I looked over to her for some help, and this is what I saw. Big eyes and a wide mouth. Well, because I was well-trained, we were able to execute a series of maneuvers, and the baby came out safely, and mom and baby did fine. There was another time at a different delivery when this baby was much smaller. That one was 11 pounds 5 ounces. This one was like 11 pounds 3 ounces. But it got even more stuck than the last one. I remember afterwards the father saying, all I could see when I looked down was the muscles on your forearm bulging, because I was pulling hard, and mom and baby did fine. There was a surgery once. A patient of mine had kidney cancer, and we went in to remove this tumor. Unfortunately, when we got in there, we found that the tumor was attached to the inferior vena cava, which is the large blood vessel that brings blood back from the lower extremities up to the rest of the body. And unfortunately, while we're in there, we got into this inferior cava. Now, there's a rule in surgery that all bleeding stops eventually, but I did not approve it that day, and she bled a lot. And I was a little bit scared about this. Surgeon was calm, he used his training, I helped him, we fixed her up, and she survived for many, many years after that, but that was a scary moment. I have diagnosed cancers that have led to cures. I have properly prescribed medications that prevented heart attacks and strokes and treated illness. These are all examples of how my training has allowed me to carry out my duty to my patients. But one of the most important things I do is I help people die. Now that sounds funny, I never would have thought that, but we're all going to do it eventually, right? It's like there's no choice. Eventually we're all going to have to go through this. But medicine doesn't like it. We don't like death. We don't like to deal with it. And we can't stop everyone from dying, but it hasn't prevented us from trying. And we spend 60% of all healthcare costs in the last 6 months of our lives. We haven't learned how to let people go. I got close to Don before he died. Don was a patient. And part of the reason I got close to Don is we had a shared love for this great university of Notre Dame. I went to school there. Don was a huge fan. We talked football. And this was even before he got sick. We kind of had to tell stories. But when he got sick, we got close because of his illness. I went to visit Don approximately 2 weeks before he died at his home. I remember sitting by his bedside. I was holding his hand. We were talking. We were alone. And he looks at me and he says, Doc, I don't know if I've been good enough to go to heaven. What would you have done then? I could have deflected the question. I could have changed the subject. I could have miraculously hoped a pastor would appear. But I did what I could to comfort his angst. I said, Don, you believe, right? He said, oh, yes. I said, Don, then what I understand about heaven is that we can't earn our way there. It's a free gift for all who believe. And because of your belief, there's a place waiting for you there. He smiled at me, kind of squeezed my hand, laid back and fell asleep. What I did that day had nothing to do with my training or my knowledge, but just some words of comfort that any of us could have said. But it was a privilege for me to be that one that day. Now, healthcare is a big business. Make no mistake, it's a big business. That's one of the last businesses that's had to undergo a transformation, but it's happening now. Up until now, we've made lots of money off waiting for people to get sick and trying to fix them. And unfortunately, patients have been okay with this. Contributing to our poor health by questionable lifestyle choices and then expecting medicine to rescue us when we're near the end. In reality, our health is kind of like the elastic in our underwear. Too much stress stretches out, and it never goes back to do the job intended. We keep talking about how we have the greatest healthcare system in the world. Well, in fact, we have the greatest disease care system in the world, where we spend by far more money than the other developed country, and yet have the poorest outcomes compared to these other countries. So when I came to a full appreciation of that I was part of this healthcare system that was dysfunctional and even obsolete, I felt I needed to do something about it. I remember thinking I wasn't being altruistic or that it was the right thing to do. I was feeling like I had no choice, like I would regret it if I didn't. Sound familiar? It's kind of like our healthcare system was like Bertha, profoundly depressed and even bordering on psychotic, and needed an element of caring to make it right. Now granted, injecting an element of caring into a dysfunctional healthcare system may be just a little more complicated than befriending an elderly woman, but the principle is the same. A need has arisen, I became aware of it, and I felt a need to do something about it. So what did I do? What could I do, right? I'm just a family doc, right? Well, the first thing we did is adopt a model of care called a patient-centered medical home. Now this is my practice here, okay? And we are a certified medical home. But to be clear, medical home is not a place. It's not a noun. In fact, the medical home is a verb. It's the way that we give care to patients. In fact, the way I can define medical homes, because there's some really fancy definitions, but I consider medical home a place where we give patients permission and expect them to take care of themselves, and we put systems in place to back them up. And please understand that the systems that you use to try to help people stay healthy are totally different from the systems you use to try people when they're sick. In fact, the systems that you try to use when people are sick are probably easier than the ones we're doing now. In fact, they are easier than the ones that we're doing now. It's much harder to try to promote health than it is to treat sickness, but it's what we have to do. So, what is the major ingredient or thing that you have to do to become medical home? It's education. It's education for the staff, it's for the physicians, and then for the patients that we have to encourage them. Did you know that doctor means to teach or instruct? I didn't know that. That's the original meaning of a doctor. So we have to teach and instruct our patients that there's a better way out there. So how does it start? It starts the first day a new patient walks in the door. They're required to take a patient orientation session. At this session, they learn about our doctors and our hours, but they also learn that their health is their responsibility. And we're not there just to put pills on them. We're not there to just tell them what to do. They have to know their medications. They have to know their chronic health conditions. They have to try to strive for healthy habits. This whole slight idea changes everything. When they walk in that door, they're fully expected to be an active participant in their care. It's been a lot of fun. But I'm telling you, this can't happen by physicians alone. In the old days, physicians were responsible for doing everything to patients. But now you have to use your staff to make it happen. So this is my staff here. I'm in the middle, obviously. Rachel's to my right, and Amy's to my left. Rachel's been with me just over a year. Amy's been with me for over 22 years. I keep telling her that she's on a trial basis, but I don't think she believes me anymore. Together, we are a team who take care of our patients. It's not just me taking care of the patients, it's our team. Now I'll tell you this, there are some of our staff who couldn't be medical home employees. They couldn't take that extra step. They didn't want to be challenged. They didn't want to be kind enough to be that kind of employee. If you notice, I'm dressed the same way as I am in that picture. Casual Fridays. This is how I dress in the office on Fridays. Margaret didn't think that was very professional. We explained to Margaret why it was, and she still didn't quite understand it, but I think eventually she got to realize, and it may be a subtle little difference, but the reason why I dress casually is that I don't feel like I'm any different than anybody I see in the office, and now I'm comfortable with it. Do you know where the Dr. White coat came from? It came from back in the 1920s, when medicine was considered to be more quackery than anything else, and the lab coat was adopted to appear more scientific. But I think over the years, we got to the point where the white coat symbolizes the doctor who has all the answers and the patient who just kind of passively takes their advice. And sometimes that white coat can be a barrier between the doctor and the patient. Now, I do occasionally wear white coats in the office, usually on 2 occasions. One is if I'm cold, or 2, if I spill something on my shirt at lunch. But most of the time, I don't wear white coats. I'm with my patient level to level, and again, I want them to know I'm just like them. There's a huge need for the rest of our healthcare system to realize that there's a better way to deliver care. There's a better way to interact with patients. And what we've provided so far hasn't worked. I felt called to do that. So I've come to discover what gives true meaning to my life is not what I accomplished because of my duty and my training, but because of my caring, because of being responsible to that voice inside of me that says I need to do something. The really cool thing is, it doesn't matter what your job is or what your occupational life will be. We will all be given opportunities to recognize those needs in people and to act upon them. And we have to choose, right? That's our responsibility to choose. Relationships. It's all about relationships, right? Nothing else really matters. These are my college roommates. That's Bob in the back. To his left is Bill. And that's Mike in front. We have other colorful nicknames that I won't share today. Probably wouldn't be very appropriate. But I've known these guys for over 35 years. I hope everybody gets a chance to have friends like this in their life. These are the kind of friends that when you get together after having been apart for a while, it's like nothing has passed. Time has stood still. Now, our receding hairlines say otherwise. But aging is not so bad, right? Aging gives a sense of urgency to our life to want to accomplish things. I spoke with Mike a little while back, and I told him I was speaking today and what I was talking about. He said, you know, I think I've lost kind of my calling. I've been so busy that maybe I forgot what I went to medicine to begin for. And then I wondered, why don't I have more Bertha or Don stories to tell? Is it because in my zest to do much, I become distracted and I'm missing those needs, those opportunities that come my way? Maybe so. On one of my last visits to Bertha, she looked at me and she said, I think an angel brought you to me. Now, at the time, I didn't think much of it. I kind of brushed off, but I did think it was nice, that affirmation of our friendship. But maybe angels are real. And maybe angels are that voice of responsibility that tells us to do something that may define our lives. My hope for all of us is that we'll be responsible enough to care. Thank you.